good afternoon, everybody. I would like to welcome you to our fourth in a series of webinars that we do as part of the Cheshire and Merseyside Public Health Research Hub. I've got a little bit of housekeeping for you all, so bear with me just while I go through that. So the first thing you need to know is that obviously we've turned off cameras and microphones just to support bandwidth, etc. You will, however, see the presenters. During our breakout sessions, then the cameras will come back on and obviously be able to speak. We've got the chat facility where we'll be asking you to put questions. Because we've got quite a busy agenda today, we'll be asking you to put your questions and comments in the chat bar. Please engage with the event by using the hashtag that's been placed in the sidebar again for you to see. When I say sidebar, I'm talking about the chat, and it is hashtag. I don't use Twitter very much myself, so it's hashtag CMPH Collaborative Research Hub. As I've said, we're going to split into groups after we've heard from our speakers, and there should be a facilitator in each of the groups to help, because we'll be asking you to feedback on a quite crucial question. As I've said, the event will be recorded. Now, the elements in the chat won't be recorded and won't be available online, but the main session is being recorded and will be available online on the CHAMPS YouTube channel. And finally, of course, you will have access to the slides and you can share these with colleagues after the event. So as I've said, this is fourth in a series of different chats that webinars that we've arranged for you, and it's very much based on the feedback that you give us. So if there's something that you want to see us present at a future event, please let us know. If there's a question that arises as a result of this, again, please do let us know. So in terms of format for today, we've got 3 different speakers who will be giving you some information. We've developed some questions that we'd like you to think about. And as I said, we're going to break into chat groups that enable us facilitate and discuss those questions. So I think really that's all you need to hear from myself. So as I've said, we've got 3 different speakers. The first is Lisa Jones. She's a reader in public health at the Public Health Institute, Liverpool, John Moores University. And she's got over 20 years of experience of working in research. She's actually worked previously with us supporting CHAMPS around evidence synthesis. So she should be quite recognizable, if not by face, at least by name, to many of the people that have joined the chat today. Also from John Moores, we've got Dr. Gillian Hutcheon. She's a she's a professor in pharmaceutical biomaterials. Sorry, I need to put my teeth in today. Pharmaceutical biomaterials in the School of Pharmacy and Biomolecular Sciences at Liverpool John Moores. She's very interested, like Lisa, in facilitating research and supporting researchers to develop, and she's got a short update to give us. So our final speaker is Joanne Puddephatt, and she's a lecturer in psychology at Edgehill University. She's previously held research posts at both the universities of Liverpool and Lancaster. Like Lisa, she has focused her research on alcohol and also mental health problems, and also about how accessible health services are to various groups. So she's also going to be talking to us a little bit later on. Now, I believe we have an agenda which hopefully many of you have already seen. So if we can pop that up, you'll be able to see what each of our speakers is going to cover. So I'm going to invite Lisa to come on first. Hopefully we'll be able to sort that out. Thanks very much, Lisa. So over to you.
Thanks, Ifeoma, and hi everyone. I'm Lisa Jones, and I'm going to be talking today from an academic perspective about public health research. So I've got my ivory tower here on my slide. So hopefully just to break down those ideas that we are sat in our ivory towers in the university. So first I'll tell you a little bit about my research experience and about the public health research that we carry out at Liverpool John Moores University. And then I want to share some thoughts about the academic and the practice policy gap that we can see in public health, and to have a look at how we might look to overcome that within Cheshire and Merseyside. If I have the next slide, please. So you've heard a little bit about me already. My main research experience is in systematic reviews and other types of evidence synthesis. I've led systematic reviews and other types of reviews for many different audiences, many different commissioners. For several years, I was involved in doing reviews for the NICE public health programme, and I've worked with Public Health England. I've worked with the UK Chief Medical Officers on alcohol guidelines, and I've also worked with the World Health Organisation as well. As well as that, I'm also involved in teaching public health research methods and also systematic review methods as well. And I've a real interest in evidence use in public health decision making, and I think the systematic reviews can be a really useful tool for building skills in research and evidence use. And I know through my own experience of doing systematic reviews, I came from a background of doing evidence reviews in more clinical areas. But coming through and doing those reviews in public health, I've learned a lot about different types of public health research and a lot about some of the challenges as well that we face in trying to do public health research. Have the next slide, thank you. So we've a long history of doing public health research at Liverpool John Moores. We've had a research active centre institute for over 20 years now. I myself have been there for 17 years, so public health research is very established at John Moores. So the Public Health Institute where I'm currently based is our research focused institute, and we've close links as well with our public health teaching team who deliver our undergraduate and postgraduate talk programmes. And we've also got a number of PhD students as well working on different areas of public health. We're currently, I would say, a fairly mid-sized unit. We've got 5 professors, 3 readers, including myself, and around 20 research staff who work across various different types of projects. And a lot of our staff are on what we refer to as fixed term contracts. So we don't have a permanent group of staff. We have to fund each of those staff through the different research projects that we bring in. So we can kind of grow and contract in size at various times, depending on what type of funding that we've got. And if you'd like to find out a bit more about sort of John Moores and about the Public Health Institute in particular, we've got a website that you can find through the John Moores University. You can see a bit more there about our areas of expertise and some of our achievements as well. If I can have the next slide. Thank you. So as well as the Public Health Institute, we also have a virtual research institute, the Institute for Health Research, and that provides a hub that works across the university to bring together lots of different researchers who do health research. And given that public health crosses so many disciplinary boundaries, I think it's quite a useful place for you to know about that we have at John Moores, because it can link you into lots of people doing lots of different types of research that may not be badged under public health research and sit in our Public Health Institute, but actually is very relevant to public health. So our Institute for Health Research is currently led by Dr. Kathy Montgomery. If anybody is interested in finding out a bit more about the IHR, then please drop me a line or Gillian a line, and we can put you in touch with the people to speak to. We've got a number of interest groups that link in across these different areas of research that we've got at Liverpool John Moores University. Next slide, please. So this slide summarises some of the main sources of funding that we will look to fund the research that we do in the Public Health Institute. We do sometimes receive direct commissions, but most of the research, the funding that we need to get, we have to go out through what we call a competitive tender, so through a competitive process where we apply with other universities, other research groups for that money. And across the Institute, we've got quite a mixed portfolio depending on our individual interests and our areas of expertise. So sort of across the groups that we've got here, NIHR is a fairly key funder for us. So we've funded different types of review work, different types of studies with NIHR funding on different public health topics. But for example, as well, we've also had staff funding through fellowships through the UK Research Council, so Wellcome Trust and ESRC, which is the Economic and Social Research Council. But the nature of sort of a large chunk of our research is very applied. And as you heard before, we've worked closely with CHAMPS before to deliver research. And also a number of our groups work directly either with public health teams in local government, or they would have worked previously with the CCG and still bedding in with that new ICS structure, and sort of smaller local charities as well, to really fund that kind of locally relevant applied research that we do. So quite a mix of funding that we do. A lot of the local projects are quite short-term projects. We'll hear about the opportunity to get the funding. Often it's quite a short time scale for us to apply for funding, and they want the funding, the research to start quite quickly after they've made the decision about who to fund. So sometimes it can be a little bit difficult for us to plan in terms of having wider partners involved in our research, just because of the quick turnover of our work. Some of the bigger funders that we go to, like NIHR, we usually have a longer run-in for that process. So that gives us a bit more time to build those partnerships that we need beyond the university. Next slide, please. So most of the work that we do apply for is commissioned project grants. So that's where the topic or the remit for the research is set by the funder. We do occasionally have researcher-led grants. So that would be where, as a researcher, I would put in the topic. The scope would completely be my own idea, but we don't commonly do that. Like I say, a lot of the work we do is commissioned kind of public health research, so fitting the scope or the remit of a project that someone else, the commissioner, has already decided on. But there are other types of research funding that we can go for. For example, there's funds available for research networking and for fellowships as well that fund individual researchers to develop their career and their portfolio of research. Have the next slide, please. So we already heard a little bit about this, yes. At the Public Health Institute, we worked with CHAMPS for many years, and we were commissioned between 2015 up to 2021 to run the CHAMPS Intelligence and Evidence Service. And this was a small team, 2 researchers and a senior lead. So that was a role shared between myself and Dr. Hannah Timpson, who some of you may know as well. And that research was done in response to the priorities of the Directors of Public Health in Cheshire and Merseyside. So we work quite closely with Matt Ashton and other colleagues in the public health teams across Cheshire and Merseyside to set the work plan for that work. And so that allowed us to carry out very locally relevant evaluations. For example, we looked at the safe and well visits that had been carried out by the fire service in Cheshire and Merseyside, and we also undertook reviews, for example, on adverse childhood experiences. So we're really able to tailor that programme of work to what was required locally. Next slide. Thank you. So now I'll move on to just reflect on and talk a little bit about the academic and practice policy gap that we sometimes see in public health, and just orientating that to public health research and kind of trying to bridge that divide that we sometimes see. If I can have the next slide. This paper by McAteer and colleagues, it was published in 2018, so obviously there'll undoubtedly have been lots of changes in the last few years, particularly coming out of the pandemic, but this was really useful for helping me pull my ideas together for this session, and it kind of spoke to me a little bit about some of the challenges I think that we face uniquely in public health. If I can have the next slide. So one of the key challenges for public health really is the scope and scale that we work with. So I think comparing to clinical research, for example, working with population health, it brings different challenges than if you're working with the health of individuals or within a discrete disease area. In public health practice and research, we have many different stakeholders, And there's a much longer chain of us seeing outcomes and sort of benefits for the communities and the other people that we serve. And also linked to this as well, evidence-based practice, evidence-based decision making. It's not as straightforward in public health, so we're often dealing with a lot more complexity. And with public health in England now sitting in local government, we've got those challenges as well, where other forms of evidence alongside the research evidence, they're seen to be perhaps as important or sometimes even more important than the research evidence. And the types of evidence that we commonly see prioritised in the evidence-based medicine model, they're not always that useful, they're not always that usable for public health decision making because they don't take account of that local context. We're not sure about what works for whom and under what circumstances. That doesn't always clearly come across. So a number of challenges there in terms of the environment that we work in public health. Next slide, please. And in the paper, people may disagree with this, but there was this idea that public health can be characterised as siloed as well. So we've got our academic public health researchers, and we're separated from the professional public health practice, and we're not as closely linked, for example, say with clinical research. A lot of people working in public health research haven't practiced public health professionally. And we don't frequently see appointments, in universities. They're not, they do come around, but we don't frequently see appointments in universities that formally tie research to practice. I mean, one of the key issues really is that we've got completely different reward structures as well. So traditionally, as an academic, I'm rewarded for publishing in journals and bringing in big research funding grants. That's what gets me my promotions. We did a lot of years working with CHAMPS. Unfortunately, a lot of our local research, it doesn't have the same, it's really important to us as researchers, but in an academic world, it doesn't give us the same impact as we get from publishing in journals. And so that perhaps conflicts a little bit with some of the rewards that you would get from research doing that in a practice or sort of policy role. But I have to say, this is changing, should acknowledge that this is changing a little bit now with NIHR really putting a lot more of a focus on local government research. And then with a big national funder having that priority, that's really useful for us to sort of see changes and, change those reward structures for us as academics as well. So I've got a couple of minutes. So just to finish up, just wanted to cover some of the ideas from the McAteer paper about how we might look to overcome this gap. If I can have the next slide, please. Just move on, another slide and another slide. Thank you. I'll just stick with this one. So what they kind of proposed was a number of ideas, and I've just focused on these 5 here. So this idea of us having a centre or centres where we have a core purpose to bridge the gap, or with a mandate to be a knowledge broker, so acting between academic research and practice. One of the centres that they have in the North East Views is a really interesting centre for translational public health research that operates across the region's universities, and it acts to connect academic practice and policy partners in translational public health research. It looks like a really good model. Be interesting to explore whether there was something that might be feasible on a Cheshire and Mersey footprint to actually bring the different universities together. Another area is around supporting on-the-job training for health professionals. So along with other universities, John Moores offers taught masters, CPD courses, and also there's a number of opportunities available through NIHR. And I can speak for my research institute, we'd be very keen to support staff and local authorities who might be interested in accessing those types of opportunities as well. Very happy to host people to support their research development. Some of you might already have honorary contracts with local universities, and wider provision of such contracts might assist, on a more individual, smaller scale to facilitate better links. So anybody interested in having an honorary contract with the university, then, please get in touch. That's something we can facilitate, work on you with. And then this final idea in the McAteer paper was about this cross-cutting service that looked at evaluation potential of different public health programmes. But if we can, actually, I'll just stay on this slide just to finish up. If we can think about this more on a Cheshire and Merseyside footprint, perhaps agreeing a knowledge transfer exchange strategy across partners might be something that's helpful to increase joint working. And I'll leave it there now. So thank you very much for your time, and look forward to discussing a bit more with some of you in the breakout session.
Thank you very much. And I'm really quite excited about the idea of a sort of a two-way knowledge exchange process. So our next speaker I'm going to invite to come on immediately is Gillian. And as we've asked before, and if you do have any questions, please do pop them in your chat bar. Thanks very much. And Gillian, over to you.
Okay, good afternoon, everybody. As Informa said, I'm a professor in science, basically, not in public health. But Lisa mentioned the Institute for Health Research at Liverpool John Moores University, and for the I was head of that institute for five or 6 years, which allowed me to get a really good understanding of more health-based research in addition to scientific aspects of it. And I then undertook a secondment to Liverpool Health Partners, where I was head of education and research capacity building, which is where my interest in looking at research capacity and culture and health and social care has come from. I also currently lead the Institute for Health Research Workforce Development Group, where we look at research and practice into research capacity, research into and from practice, so there is an interest in this across the university. So today I'm going to give a brief presentation outlining some of the work that I've been doing around understanding, building and evaluating research capacity and culture in health and social care. And this talk today follows on from some discussions that came about after the Demystifying Public Health webinar around how academics and local authorities might work together to think about how we can understand and evaluate what research is currently ongoing in this sector. And when we think about research capacity of a group or of an organisation, we also need to think about understanding the competency, so the skills of that workforce, and also the individual capability for research. Next slide, please. Thank you. So in terms of understanding research capacity and culture, it's a very it's quite complex, and there's multiple contributory strands that we need to understand before we can start to think about how to improve this within a sector. And it's not as simple as just sending people who say they might be a bit interested in research on some training courses. We need to think about and understand what the current activity and expertise is, and where all the different pockets of research activity lies. Thinking about what relationships exist. These could be internal relationships, external, between different groups of researchers, and also including relationships with the public and senior managers within an organisation. Collaboration is very important, and we need to think about how people can work together effectively in terms of the support that they might offer each other, and also ensuring that any research that's undertaken is very relevant, and that's where academics working with healthcare professionals or people in local authorities to co-design the research that will be relevant and have meaning behind it. And Lisa touched on this as well. It's what does research mean to different people? Research is not purely academic. And I think across any organisation, it's important that there's a basic level of research literacy around what research is, why research is important, and why do non-researchers need to be involved in research. And the language that we use to describe research is very important for inclusivity, so that research is, as people say, research is by all for all. So thinking about improving research capacity and culture, one of the things is there's often a lot of initiatives to try and increase research within a group or an organisation, but it's more difficult to have an understanding if you have actually improved improved it, and what are your measures for improving? In academia, it's money in and funding out. It's a little bit more difficult when you're in looking at applied research, where how do you measure the research activity? How do we know how much of research has been relevant to policy and so on? And how do we know if we're improving our research? And that's what I'm going to talk about in the next couple of slides. So next slide, please. So just to give you a little bit of an overview of what I'm currently doing, or what me and some other people at LGMU are currently doing around research capacity and culture research. We're currently undertaking an evaluation of research capacity and culture across the NHS trusts in Cheshire and Merseyside. And actually, there's a poster here which we're putting out, and I'm constantly trying to tweet out. So if anybody on the call is from the NHS within CNM, I'll put the link in the chat if you'd like to complete that survey. And what this survey will do is to capture the views of NHS staff across all different disciplines and whether or not they currently undertake research. And that data will enable us and the individual trusts to have a better understanding of what's required to embed a culture of research, to grow researcher capability, and then the overall research capacity within the system. And this will potentially lead to a more motivated workforce and improve retention, which I'm sure everybody knows is becoming more and more important within the NHS, and more importantly, improve the services and patient care. What this survey does is it records an individual's perceptions of research capacity and culture across an organisational and team level, and also of their own research capability. We can also use this survey to identify pockets of good practice and look at where barriers exist and explore this more fully with interviews and focus groups. And what we really want to do is extend the use of this type of survey into other settings such as primary community and public health, which of course is relevant for us today. New slide, please. Thank you. So this survey we're using has been based on an RCC tool that was validated in Australia, and it was subsequently tweaked for UK use by a team at the Council of Allied Health Professionals and Research, CAFR, for a national survey of allied health professionals. I put the link to the paper up there that's since been published by Christine Comer et al. And just here we have an example of the type of questions at an organisational level where people would score them between 1 to 9, for example, encourages research activity relevant to practice or engages external partners in research. And this gives us a quantitative measure of research at different levels that you can then compare, say, for example, before and after any intervention. The survey itself was based on a research capacity building model by Professor Jo Cook, who worked with the ARC on the East Coast to do this. And she's also done a lot of work around generating an allied health professionals research framework. Next slide, please. So I've given the link to the framework on this slide if anybody's interested in looking at it in a little bit more detail, but I've taken some snippets for it just to contextualise how it works. There are 8 domains around sort of research skills and development that an allied health professional might want to look at in terms of research skills, and these range from methodologies to leadership, and within each of these domains there's identified research skills and knowledge that you would expect somebody to have. And for each skill, an individual would work to develop a level of competency which would go from awareness through to an advanced level. And there's guidance given around, for a particular career or researcher stage, what competency level you might be expected to have for some of the different skills. So an example here is around translating knowledge into practice, and you can see it moves from an awareness where you're using an evidence-informed approach up to sort of an intermediate level where you're working with stakeholders and the public to co-produce outputs. And I think one of the benefits of this structure is that it shows somebody what skills they would need to learn and develop to move from awareness to core to intermediate, and that would potentially support promotion from a junior to a more experienced practitioner. Next slide, please. So taking all this forward to think about it in terms of research capacity in public health and social care, we need to think about what's required to generate a strong, broad capacity to undertake research in a local authority setting, and then that will enable practitioners to feed better, have more ability to generate and use evidence in decision making. And to do this, you know, these are just sort of questions at these stages. You know, you think about what the core competencies would be, how do current career stages map onto them, what are the career pathways, and are there career pathways, or do we need more of them? How the development would be supported in terms of time, mentorship. How do we ensure that research is inclusivity in terms of, in this case, in terms of who's undertaking the research, what the infrastructure developments needed, and how do we work towards better use of research in prioritization and decision making. And this list I put up here is just a sort of bit of a random list about what we might need to consider. It's by no means comprehensive, and that's why, in terms of taking an academic approach to capacity building, we need to work with those in the sector to co-create a framework to make sure that it's suitable for its use. And thinking about this session today in terms of the academic public health interactions, it's how can academics and other sectors help create a framework for public health and social care. Next slide, please. So there's no point in having a framework, I don't think, unless you go one step forward and have some sort of toolkit, to call it something, to support the framework and provide resources for staff development, to enable staff to move from what may be a starting point of not even currently interested in research to an awareness, and then to progress along the ladder, if you like, for their own personal and career development. And not everybody will want or need to progress beyond certain stages. And I think the framework also needs to enable people to identify what skills they need to develop, and then give them access to the relevant training and expertise to do that, work with others, develop skills that enables them to lead researchers, apply research in their practice, and develop research careers. And it's not just about researchers or those who might gather data in their day-to-day practice. It's about everybody within an organisation understanding what research is about, how it's applied, and the role in the community. Next slide, please. So to start wrapping up, just a slide around what we're currently doing. So I'm working with a variety of people across public health and local authorities, including people within CHAMPS here, but also a bit wider afield, where I'm particularly working with Priyanka, who's a research practitioner in Oxford, and she's looking to develop a fellowship with my academic support around this piece of work. The general plan is that we would look to adapt the survey that I've shown you here to make it more applicable to public health and social care, again extending that out into local authority, local council remits, to speak to people to understand the current situation and what staff actually want in terms of research capacity building, work towards the framework, adapting that allied health practitioner framework around and adapting it towards local authority needs, and creation of a toolkit to support researcher development. So next slide, please. So that's finally just to say that if you're interested in any of this, please drop me an email. I'm always happy to discuss and speak to people about this. And I'm also really happy to grow the number of people that we would have working on this to help with our co-design and testing and so on of the survey. So, you know, regardless of how you might want to be part of it, if you're interested, let me know. I'm also hoping to obtain some funding through the Institute for Health Research to host a meeting or workshop around research capacity and culture in health and social care. So again, if you'd like an invite to that meeting, then let me know, and once I have more details I can send them out. Thank you very much.
So thanks very much, Gillian. I know I've spoken to you before about the RCC survey and the potential for adapting it for public health use. So fingers crossed we get the funding to support that. And indeed, as people have been invited, if you do want to be invited to that workshop, please do indicate either by contacting the Champs email inbox or simply by indicating that in the chat in the sidebar. So our final speaker today is Joanne, and she's going to talk to us about some of the traditional approaches to conducting research and perhaps some of the challenges around that. So over to you, Joanne.
Thank you. Yeah, so I'm Joanne Puddephatt, and thank you for having me here today. So what I'm going to do today is just kind of give a brief overview about how academics or how research is traditionally conducted, the problems with that, and then the ways in which we can move forward and work with communities and organisations to do better in doing more targeted research. Next slide, please. And so yeah, I'll also be talking about how the ways in which we could identify the needs of communities, some of which you might already be aware of, and then sort of the different roles that people can have in research. Next slide, please. So just to give you a bit of background about who I am and where I'm coming from. So I've previously held research posts at a few different institutions in and around the Northwest. But prior to this, I worked in secondary mental health care and in the third sector. And that's really what kind of has guided my own research interest and sort of the communities that I'm quite interested in, following on from my experiences of working with service users and working with healthcare professionals. I tend to use mixed methods, so I'll use sort of large-scale surveys for population to understand population level data, but then I also do qualitative methods to get a bit more of an insight. Next slide, please. And I just wanted to highlight that although my sort of research is in and around alcohol and mental health, we do also have established research groups at Edgehill University. So we do have researchers and academics there that do work around child and language development, around cancer and chronic conditions, and other sort of health problems that might be of interest. So if you are interested, then either drop me a line, or that I've also put the web link on there where you can find the relevant research groups. Next slide, please. So traditionally, and certainly when I started training as a researcher quite a number of years ago, as a researcher and as an academic, we would tend to develop a research idea through a combination of what we see and through sort of, for me, psychological theory or any other sort of literature base of research that's previously been conducted. And we tend to use that to either guide and design a piece of research, or we can try to understand a particular theory or some findings that other research has shown and to test that. But broadly speaking, the aim is to sort of generate more knowledge about a particular issue or a particular topic or a particular population. Next slide, please. But the problem with this is that that's relying on previous research being published and openly available. And from an academic perspective, that can be quite challenging, because sometimes there's a tendency for research to get published when they find sort of interesting or significant results, something's made a positive difference, and that's not necessarily always the case in research. Sometimes things go wrong, which could be equally as informative for us. And I think something that I've found is that it also fails to take into account local priorities and perspectives. So we know, for example, in the context of people with co-occurring alcohol and mental health problems, that the problems that those people face can depend on where they live, and it can depend on a lot of other factors that can be quite difficult to know about without including people who are living through that experience or supporting people through that experience. And myself, early on in my research career, was kind of guilty of not being aware of that, not necessarily not acknowledging it, but not knowing how to incorporate that in research. Next slide, please. So the ways in which we can better identify communities is by being more inclusive and getting academics and researchers to also involving individuals who live in the community who might have a specific condition, including organisations who might support people living in the community, but also including people higher up in the decision making, because they're the people that might be the ones that help to decide whether certain services are made available to the public. And I also think it's important to involve researchers from different disciplines. So not necessarily like myself, I come from a psychology background, but I've also worked with other researchers from health economics and sort of a sociological background who have been really important in sort of the development of research. And so for the next few slides, I'm going to be talking about my own sort of experiences in engaging communities and the other factors that we should be thinking about if we want to do that. Next slide, please. So there's a range of different research methods that we can use in order to identify the needs of communities and thinking about public health. So some things that I've done myself and also has been established in a lot of research is the use of workshops where you can engage people who not only have lived experience, but also people, families and carers and support services, where they kind of mind map what their journeys have been like in getting access to support and other factors that have been involved in that. And that can either be led by the group or if there are published recommendations. So for example, there's recommendations on how people with co-occurring problems are access support, and you can use that to kind of guide those workshops. But there's also other methods that you can use, like surveys or focus groups, that can help to identify what the key issues are. Next slide, please. And there's also quite a few things that we need to think about when engaging communities in research, because it's quite complex, and a few of the issues have already been highlighted. So we need to think about who we're involving and making sure that if we're involving people who live in the communities, is making sure that we get people from a diverse range of backgrounds, whether that's from different ethnic backgrounds, from more affluent areas of Cheshire, Merseyside, and more disadvantaged areas, because that will paint a better picture of where the different issues are and how similar or different they are between different communities. We also need to think about how we're engaging communities in research and making sure that methods are inclusive, and how we try and build long-term relationships, which is quite difficult from an academic perspective. One of the major issues is funding, and we tend to only have a limited amount of funding for a short period of time. And then we also need to think about why we're engaging communities in research, and that can be beneficial to both myself as an academic, but also people who are involved in the research, so that they know what the goal is and what the purpose is. And then finally, there's other things that we need to think about. So as there's been mentioned throughout the presentations, is funding and where we get the money from it in order to enable us to carry out research with communities and sort of identifying and addressing the needs of those communities, and also trying to think about how we set up those groups in the first place and whether there's key people that we need to be linking in with to do that, because these things can take time. Next slide, please. So I've just given an example here from a research that it was part of my PhD that I did a few years ago. So my PhD focused on how the extent to which alcohol and mental health problems co-occur together. So I set up a public advisory groups of people with lived experience of co-occurring alcohol and mental health problems. And this was pre-COVID, so it was through face-to-face meetings, where we conducted meetings once every 6 months. And the sort of core reason for setting that up was so that making sure that my big piece of research really was taking into account other factors that are known to affect people with lived experience. And I was lucky to be able to get sort of 3.5 years of funding through an alcohol charity, the Society for the Study of Addiction. Next slide, please. But there are a lot of challenges in setting up and engaging this group within research. So one of the main issues was trying to recruit enough people to form a group, and a PhD, for example, lasts for 3 years. So that's quite a significant amount of time to ask someone to dedicate, even if it's only for one meeting every few months or so. And people's circumstances can change where they don't have the abilities to take part anymore. And also in research, sometimes there's long periods of time where there's no updates on the research because you're in the middle of collecting data or you're in the middle of running an analysis. So from an academic perspective, that's all quite normal to us, but it might be something that's less familiar to people who are new to research or haven't been involved in that before. Next slide, please. So I've talked a little bit about who can be involved in research and engaging communities in research and the things that we need to think about. And I'm just going to talk about a few different approaches that we can use, which people might be familiar with. Next slide, please. So there's the sort of consultation approach where can be a bit more feasible for academics. It can also be a bit more feasible for organisations or individuals, where what tends to happen is academics or organisations may have an idea of what they want to do, or if there's a particular topic or service that they want to evaluate, and they can ask members of the public for their views and then use that feedback to inform some decision making. And so I was involved in a piece of research where they were developing a mobile intervention for veterans to monitor their alcohol consumption. And so we ran some focus groups asking where they were shown sort of prototypes of the intervention and were asked specifically about the language that was being used, how usable it looked, how sort of mobile friendly it looked. And then we fed that back, and that changed sort of the design of the intervention. And then we rolled out a pilot study to evaluate it. Next slide, please. Another approach is a more of a collaborative approach where there's sort of an ongoing partnership between academics, organisations, people with lived experience, where decisions about the research are shared. And that can be used at any stage of the research process. So from an academic point of view, sometimes what happens is we get this funding where we've already had to say what the broad aims are going to be, but then we can actually work collaboratively with other people, and that can help inform the design of research. Next slide, please. And then there's the co-production approach, which has been mentioned a little bit in previous presentations today. And the idea is that communities and people with lived experience or organisations who are affected by these particular population level issues may be best placed to design research with the support of academics and others. And this is something that I'm really interested in taking forward, particularly in and around alcohol problems and mental health problems. So if anyone's interested in that, then please get in touch. Next slide, please. Thanks. So as I mentioned before, earlier in this presentation, there's lots of different people who live or support those in the community, as well as those sort of higher up in the sort of the decision making within local areas. But sometimes when we're thinking about getting research set up, it can be quite difficult to know what people's roles are, and that can certainly change. And I'm just going to talk about what the different people's roles are, but it's not exhaustive. There's plenty of ways people can be involved in research. Next slide, please. So in terms of people who are living in local communities, they may have a specific condition that we're interested in. They might be trying to access a service and we want to know more about that. Involving them and engaging them in research can help to identify their sort of journey and getting support, what the sort of barriers they've come across, some things that might have helped them. But in and around that is making sure that we're involving people who might come from a range of different demographic areas within Cheshire and Merseyside, but also who may come from different backgrounds. And this is something that we've been doing as part of a project which looked at understanding minority ethnic groups' patterns of drinking and their experiences with poor mental health. And through involving these minority ethnic groups in our research and collaborating with them on the project, they've been really invaluable to giving us an insight into their own experiences, and they've helped design studies and sort of design the questions that we put towards interviewing NHS staff. Next slide, please. In terms of thinking about involving people from organisations who provide services to those living in communities, that can be really helpful in understanding what services are currently available or services that are no longer available and why that's happened. And it can also give us a good overview of what the issues are that they see from their service users, but also that the staff experience themselves and where the gaps are that we could potentially look into more. And again, we've done that at the moment with the project that I just mentioned that's funded by Alcohol Change UK. So we have a stakeholder group of national organisations who support people with alcohol and mental health problems and who specifically support minority ethnic groups. And it's been really useful to have them on board in sort of identifying key problems that they see from their services, and also as a way of presenting what findings that we're seeing with the project and how that reflects what they see in their service. Next slide, please. And we can also, from the perspectives of those involved in the decision making and allocation of funding, this can be really key in identifying where the local priorities are, how funding is allocated to services within the communities. And that can be really helpful in the development of, if we're thinking about looking at a particular topic, or if we're looking at a particular service and thinking about other factors that we need to be considering. Next slide, please. And then using academics and working with academics and involving them within research, even if it's not necessarily something that might seem useful to different people, but if there's particular research topics that you have in mind, or you're particularly interested in a particular topic or a service, academics and researchers tend to have a good knowledge about different methodologies and the way in which you can do that, as well as knowing what might have been done previously and what's worked in the past. Next slide, please. And finally, I just wanted to sort of put it out there that something that I'm looking to do in my own research, and something that is a sort of priority at Edgehill as well, is sort of thinking about how we build long-term networks with not only people living in the communities, but other local organisations, and how we kind of overcome sort of the issues, sort of the population health issues, as well as, for my own research, alcohol and mental health problems and the problems that people might face. And I'm sort of interested in co-developing research ideas for funding applications, and they can usually take time to do. So I want to try and sort of build a way of doing that in sort of the long term. So yeah, if anyone's interested in hearing more about that, then please do reach out to me. Thank you.
Thank you very much. And I can see the virtual hands clapping there. I find that really, really interesting. And I know a number of colleagues, as I put in the in the chat, we're all required to have combating drug partnerships. And as part of that requirement, we look not only at the impact of drugs, but also people with dual diagnosis, so drugs and alcohol use, and that quite often overlaps, as everyone will know, with mental health. And so I'm sure that there'll be a number of colleagues who'd be really interested in following you up. I certainly will be following you up after this to see if some of our intentions align. So the next part of this is actually our breakout groups, where we'll be asking people to actually have a bit of a discussion about some key questions that we've had from our colleagues who've spoken to us today, and then we want you to actually feed back. As I'd mentioned before, when we move into the chat groups, our cameras and microphones should be working fine for everybody. And although those sessions will be recorded, that's simply so that we don't capture any of the conversation. You should have a facilitator in your groups that will help to actually collect the information and feedback on the crucial question. And the other thing, just to remind you, is that the recording that's done in the breakout groups doesn't get shared subsequently. It's just this first part. So without further ado, I'm going to stop talking and pass over to our team who are going to move us into these breakout groups, and then we'll see you back again at 1:15 for feedback and any final thoughts. Thanks very much. Hopefully we're all back now. And as I said before, I'm not sure if you were all in when I said it. Hopefully you had as interesting a discussion in your group as I had in the group that I was in. So I'm going to call, oh dear, Michelle said she had an abrupt ending. Many apologies for that. That means that your discussion must have been really, really bubbling on quite a lot. So I'm actually going to put you on the spot, Michelle, and invite you to give some short feedback on the sort of the last question you were asked, which is about what are the 3 ways that universities can support public health research. And then I'll ask Steve to come on after.
Ah, that's great. I've got permission to put my camera
To
on and
speak?
everything. Yeah, we were in full flow there, Ifoma, and we suddenly just got chucked out of the room.
Slurped
So
away.
right. So you want me to feed back on the top 3 ways
Yeah,
discussion?
what do you think?
Yeah, so our group thought that having research capacity and literacy in local teams, in local authorities, you know, I certainly feel that from my own perspective in St Helens and things we want to do with our team. So we thought that that was important to have that in place. And then other things, the sort of the last 2 merged into one, and this is where we're having our conversation really. There was a chap on our team from the fire service, so we were talking about the importance of collaborations locally. So it's not just about local authority, but other organisations actually, including the third sector and local communities. So conscious that third sector has very often got really good relationships with local communities already, and also have access to a wealth of information that maybe local authorities don't, and also have that trust with local communities that maybe local authorities don't. So there was something there about collaboration and co-production and design as well. So top 3, capacity and literacy, the collaboration and the co-production and co-design. Got there eventually.
Fantastic, Michelle. And I actually think when I invite Steve on, he's going to say something fairly similar, because we started to move into that space of, okay, it's all very well public health, local authority and academia, but actually true public health research questions need to come from the community. So over to you, Steve, and if you can feedback on the group that I sat in.
Thanks, Ifoma. So we had a really interesting discussion, and the sort of first point we came up was around you know, the issue of sort of that Lisa talked about sort of honorary contracts, and the gentleman in our group felt that actually we perhaps that's a good idea. We need to go a little bit beyond that and make those discussions, make those sort of contracts a little bit more like joint appointments, and try and develop a sort of medical type model where an HCI and a clinician may have a really close relationship, but perhaps that doesn't happen in public health. So we need to try and work towards that. we also talked about that the universities need to find ways of giving back. So certain types of research, you're not allowed to pay people for their time. So the university needs to find other ways of giving back, and that may be through some sort of training or some information for the local community to develop their skills and understanding of some of the health challenges, particularly around the marmot challenges that we all face in Cheshire and Merseyside. And it's important again to ask communities what they want. You know, that sort of co-creation of research questions is really important. We've been guilty of doing research to people, not with people, and that's somewhere where we need to get to. And we also have the idea of making the sort of higher education institutes become part of the community and to be seen to be part of that community by the community, and that would actually help to drive future research, because if you're engaging with the community and the university is linked in with that community, then that will drive future research, because opportunities to ask different questions that are coming from the community will ultimately be engaging in those people's lived experience. So I think that that sort of links into what Joanne was talking about that sort of need to be engaging with our communities, and that clearly you know, the issues of health inequalities are a huge priority for all of us in Cheshire and Merseyside, and that we need to make sure that you know, those marmot principles are potentially driving the direction of research across Cheshire and Merseyside. So that's in a rather less than brief nutshell. That's it from me.
So, as we draw to the end of our session today, as ever, these webinars that we put on, many of the ideas are generated by the people that attend. So is there anything that you've heard here today that you think we need to explore further? Do you have any burning questions that you're still left with? Please, if you do, pop them in the sidebar. And we've actually got a burning question for you. We've got a take-home, so we've got a piece of homework for you all. It's a take-home question. Helen will hopefully help me by writing it in the sidebar, but I will repeat it to you here now. What examples do you have of partnerships, perhaps that you've already got with universities, with research teams or individual researchers that have worked really well and have supported you to be involved with or actually carried out public health research? I'm really keen to hear about those, because A, we can put them on as examples of good practice. And if we don't have them, that begs the question, why don't we have them? And what can we do to actually establish them? So again, if you've got any examples of partnerships that you've already got with universities or research teams, could you let us know by emailing the same address that invited you to this, which is the Champs Public Health email address. Again, if you've got any burning questions, pop them in the sidebar and we'll certainly think about bringing them forward for a future webinar. Steve, do you have any final thoughts or reflections before we bring today to an end?
Yeah, I think it's been a really fascinating session. I think the insight into what academics want from the process that all of our presenters gave, I think was very interesting to me. And I think in terms of our next steps, the developing of our sort of research-ready communities, that's some work that's already going on in Hutcheon with NIHR colleagues and some of our public health team, and also some of our community sort of advocators. That I think is a big positive coming out of today. And obviously I've only been in post for a couple of months, and that today has been a real help for me in terms of thinking about what our next steps are and how we can help drive things forward. I'd also do a little bit of a sales pitch. If any of you in the public health world, in local authorities, have got any projects that you're interested in having evaluated, there's actually a call for an expression of interest from NIHR. So if you want to know more about that, please get in touch with me. You can do that via the Champs email address. but I'll yeah, definitely get in touch, and I can give you some more information about that. So.
And then just before we close again, Michelle, do you have any reflections on today? Not wanting to put you on the spot or anything.
No, I just think you know, we're all here because we're keen to progress this agenda, and there's some good ideas I just put in the chat around maybe building capacity by involving students or trainees in maybe smaller pieces of research that don't have to be randomized controlled trial standard. So I thought that was a good piece of advice. And I've also put in the chat, you know, we have actually got some good examples of evaluations that several of us have been involved in. So, you know, just wanted to say, for some reason, evaluations seem to be easier to progress than original research. I think that's it for me. I know we're running out of time, so but thanks, IFOMA. Thank you.
Thank you both, and I just want to say thank you again to the speakers that joined us. So that's Joanne, Gillian and Lisa, to the CHAMPS support team, to Steve for working so hard behind the scenes to bring this all together, and also for everyone that's attended today. Please, as I said, there's a huge amount of chat that suddenly arrived in the sidebar, how to get into contact with CHAMPS. Please contact Steve if you want to know more about the first evaluations. There's been several requests that I reach out to various organisations. Don't worry, we'll pick that all up. So good afternoon, everybody. I hope you've had a good time today, and we'll come back, same place, same time-ish, in about 3 months' time with another webinar, which hopefully will be fueled by some of the discussions and reflections from today. So thanks, everybody, and good day.